This video is going to show you some knee strengthening exercises with a specific focus on the quadriceps for patients at around the month 3 to 6th mark following ACL surgery. It's important to note everyone will be different in their stages of recovery, and the protocol should be used as a guide rather than definitive timescales. The first exercise we're going to go through is the split squat, which requires the rear foot to be elevated on a stable surface to ensure we're working on the standing leg. You can see from the side-on view, the end position of the exercise, the knee and hip are almost parallel to enable that time under tension for the quadriceps. The exercise can be made a bit easier by not going as deep and as parallel with the hips and knees. So we can add dumbbells or a backpack with books as extra weight onto this exercise to make it a bit more difficult. The single leg squat is one of the more difficult exercises for patients to perform, as it requires the leg that's not being worked to stay completely off the floor. The deeper the squat, the harder the exercise. It may be too difficult or too early for some patients, so it's important to assess the person in front of you when prescribing this exercise. It can be used as a really useful tool to compare the strength and stability of the operated limb and the non-operated limb. Clock face lunges are a useful way to combine a bit of strength work and predictable changes of direction. It won't serve as a pure strengthening exercise, but it can increase confidence in planting the lower limb and knee in different directions. It's generally accepted that at 12 weeks onwards you can perform a seated knee extension through full range of motion. It can be done with bands at home, such as a power band, which I'm using here. However, in order to truly know that you're increasing the strength, a knee extension machine is ideal for progression. Variations on the exercise can be done, such as single leg instead of double, high reps, low weight, low reps, high weight, with working to fatigue when the patient is ready. If a patient doesn't have access to the gym, it's not an issue. I would look at alternative options such as some of the earlier exercises to progress this patient and assess them.